Good morning, everyone. It's Facial Plastics Friday. It's Dr. Brace here. And for today's Facial Plastics Friday, I'm going to talk about mandible fractures or jaw fractures. A lot of people don't know, but as a facial plastic surgeon, one of the things I do, one of the populations of people that I take care of are trauma patients. So whether that's a soft tissue trauma to the face and the neck or bony, often I will get called by our emergency room colleagues to come and help a patient who has had an injury where something has been broken. And so for today's topic, I'm going to talk about a jaw fracture. I saw this young woman recently with a parasymphyseal fracture, so a fracture right at the front of her chin here, basically, right through, and it was displaced, meaning the bones were not lining up, the teeth were not lining up. She also had a fracture in the subcondyle region out here, just below the jaw joint, and unfortunately also drove her jaw up through her ear canal and had a fracture in her ear canal. And so we went to the operating room after doing imaging, and I was able to fix these fractures by using plates and screws for this fracture and wires on the teeth. And so a lot of people have questions often about interdental wiring or maxillomandibular fixation. I want to talk a little bit about that. So when you have a jaw fracture, because you can't put a cast on someone's jaw, we have to splint the jaw or keep it from moving somehow. And we use this wire with eyelets called arch bars. So we cut them, they come on a roll, like a roll of wire. We cut them to fit your dental arch, upper and lower teeth. And then we use wires between your teeth, and we twist those wires down on the arch bar to hold it to your tooth. And that gets done all the way across your upper and lower dentition. Once the arch bars are in place, there are little eyelets, little hooks on them. The bottom ones are hooked down, the top ones have the hook going up. We're able to loop wires around those hooks and twist them together to cinch your teeth together. And so that's called maxillomandibular fixation, or MMF, and it basically works as a cast. And the reason we do that is because we don't want you opening and closing your jaw while a bone is healing, because we want the bone to heal in the right position. The main goal, the main functional goal with repairing a fracture that involves your teeth is getting your teeth to line up. And so using MMF allows us to line up your teeth, to hold it there, and then to fix all the fractures. So one of the modalities that we use to help plan this surgery is a CT scan. And I wanted to show some images of what jaw fractures look like on CT scan. There's two different types. There's the traditional CT scans, and we get these in axial, sagittal, and coronal views, and that means different planes. A sagittal is basically planes of imaging kind of going through the body like this. So it's a worm's eye view. You're looking at a cross section cut through the body like this. A sagittal section is a cross section cut up and down, so you're looking kind of through the person's body that way. And then a coronal view is as if we're cutting up and down this way, but marching through the head, front to back, back to front. So we use these to kind of localize, measure, and figure out what's going on with each fracture. But the really nice thing is CT scan 3D reconstructions, where the software, in 2021 can put those three different planes of imaging together and give us a 3D model on the computer screen of where these fractures are. So I'll show these images here so you can see what a surgeon sees when they're planning on fixing a fracture. And again, to fix these, we go to the operating room, people go to sleep, we wire the teeth together to get the teeth lined up, and then we line up the bone edges. We use titanium plates and screws to put these fractures back together. And then we keep your teeth wired shut for about 3 weeks to allow the bone to start to heal. And after the bone has healed for about 3 weeks, the wires that are wiring your teeth together, the loops that are bringing both arch bars together, are cut. We use elastics for another few weeks, and then the arch bars can come off. For this poor patient who had the fracture of the ear canal, I had to pack the ear with a dissolving pack to stent it open so it didn't scar shut and give her hearing loss. And we'll do some hearing tests later to make sure that everything has healed up and that her ear is working fine. But that is one example of a facial trauma that a facial plastic surgeon like myself would deal with, and what would go on, what would go into planning that, and what happens in the operating room, where we end up using titanium plates and screws to put bones back together. Those will stay in there forever. They don't come out unless there's an infection or a problem. And so you live with those, and they're quite low profile, so you don't really feel them in most cases. So send us your questions. If you have any questions about facial plastic and reconstructive surgery, whether it's traumatic or cancer reconstruction or cosmetic, happy to answer them. Everybody be safe this weekend and have a great weekend. Bye-bye.